The Comprehensive Health Education Project under the Ministry of Basic and Secondary Education held a day-long event to share the results of its research on the project with journalists who cover health and education issues affecting children, youth and women. The research study was conducted in 43 upper and senior secondary schools and 28 wards in the Greater Banjul area from Banjul to Abuko. The forum will disseminate the research findings to all stakeholders. Fabian Aina Grant-Sagna, the principal investigator of the Comprehensive Health Education Research Project, provided the background for the research.
The research is an implementation research and being implemented by MoBSE, as I mentioned, funded by IDRC in Canada. So we're doing research in schools and out of schools as well. In 43 schools, we're conducting the research, and we're targeting 1,505 students. For the 3 school principals as well as 129 teachers. And for the out of school, we're targeting the out of school adolescent. And when we say out of school adolescent, doesn't mean that adolescents who have never been to school, but we have adolescents who have been dropouts based on gender-based violence, based on poverty, or other factors that leads to their dropouts. We also have their parents as well, the community leaders, the religious leaders, as well as the youth leaders as well. So we're doing an implementation research, implementation, and then activities that can be done in the schools as well as in the communities on adolescent sexual reproductive health, comprehensive education.
The Gambia has comprehensive health education policies in place, but there is little evidence that these policies are being implemented. Additionally, there is little knowledge about how the different partners involved in comprehensive health education are coordinating their efforts. Fabian Aina Grant-Sagna informed Kerr Fatou that the dissemination meeting with journalists was to have them write about the comprehensive health education so that Gambians would be aware of its importance.
Journalists are key stakeholders in society because you're the ones who transfer the message to the community, to society. So it's important once we conduct research, that's an evidence-based research, it's important to invite different media personnel to come and get the information so they can also sensitize, because you are part of society that sensitizes society as well. So you translate the information, inform the society that there is something happening, there is something that we have learned, there is something that we never know that needs to be known or needs to be heard by everybody in the country, especially adolescent sexual and reproductive health education. And the reason why we are doing this dissemination, this comprehensive education started since in the 90s, and it used to be population and family life education, which used to be a standalone subject, but for the past 20 years it has not been taught because of different factors that is behind it. So now it is called comprehensive sexuality education in 2017. But the word sexuality is always considered as a norm, a taboo. People don't talk about it. People are ashamed or they don't feel comfortable to talk about it. So now MoBSE came up with the word comprehensive health education because health is broader and is more accepted by all. Since sexuality is no way we can discuss about it, but health, people will come and listen and then we'll incorporate sexuality. People feel to understand that there is difference between sex and sexuality. So once in the Gambia, once they hear sex, they think more of the act than the knowledge. So for us, we are talking about sexuality, and we want the journalists to understand that there is difference between sex and sexuality, so that once they are transferring the message or the information to society, they are able to tease out the difference between sex and sexuality so that people can understand it. For religious leaders, because they mentioned that it is something that is knowledgeable. Even some religious leaders or elders, they don't understand. So once you transfer knowledge to them, they will understand and start also explaining to their own community, because we have trained the religious leaders, we have trained the cultural leaders. So any gathering that they have, they always tell them, talk to the young people about sex and sexuality. Because even in the Holy Quran, in the Holy Scriptures, it is mentioned that someone who have adequate knowledge about things that people don't know is good to explain to them. That's why we call the journalists, so that you can understand and able to transfer knowledge or explain to the society about the dissemination, about the research find that we have conducted here in Region 1.
The overall objective of this study is to investigate the barriers to the implementation of comprehensive health education in Western Region 1 of Kanefe Municipality, which has a large population of children and adolescents. The information generated will be used to design and implement relevant school and community-based programs in the region. Mr. Michael Hamadi Seka, Curriculum Officer under the Ministry of Basic and Secondary Education, had this to say about comprehensive health education.
We used to have what we call the POP FLE. That's what most of you went through, but I assume that most of you are young. At the time POP FLE was taught, you were not born or you were very young. So, but this was not an examinable subject. So teachers were not taking it very seriously. So what was the repercussion? You had a lot of teenage pregnancies, unsafe sex, early marriages, gender violence, and name it. So therefore, the principal investigator said, I must do something to address this, because our children are sent early out of school. What is going to be their fate? So therefore, we came up with what we call comprehensive sexual education. But the word sexual, you see, raises a lot of eyebrows from the religious leaders. We live in an Islamic or Christian society. Therefore, sex is a taboo. So just as the West and other countries use other words to beautify situations, let's say when they want to cleanse a whole tribe, they say genocide. It's a word to make it nicer. That is to cleanse a whole tribe. When they wanted to attack, they say allied forces, when they are armed bandits. So we call that euphemism. So we also said we are coming up with comprehensive health education. And that's why you have comprehensive health education now. And the research has been found, so therefore it's not an action paper. It's not a position paper. It's something research. It's not a postulate, it's an axiomate. It's axiomated. It's conducted and found. And everything is true about it. So that makes it very fundamental. And earlier on, the research findings has exposed a lot. And that's what the principal investigator, as well as the analyst, has tried to do, to fill those gaps. Because in research, you must emerge with recommendations.
The expected outcomes of this study will be the identification of challenges to the implementation of comprehensive health education and the institutionalization of relevant school and community-based programs that can be used to strengthen access to quality comprehensive health education, information and services for both in and out of school adolescents. The study also expects to result in more effective and efficient coordination of comprehensive health education across various partners. Reporting for Kerr, Fatou, I am Landin Cisse.